Hello and welcome back to my channel. In this video, I'm going to talk about the blood supply of spinal cord. So the blood supply of spinal cord mainly comes from the spinal arteries, which are the anterior and the posterior spinal arteries. These spinal arteries come from the vertebral arteries, which are the anterior and the posterior spinal arteries. These spinal arteries come from the vertebral arteries. Let's see it in detail. The vasculation of the spinal cord is by the vertebral arteries and the medullary arteries, which give the segmental branches, which are 10 in number. And the vertebral arteries, as we know from the previous video, they come from the subclavian artery on the either side. The subclavian artery on the either side gives off the vertebral arteries, which travel all the way along the foramina of the transverse process of the cervical vertebrae in the cervical region. Enter into the foramina of the transverse process of the cervical vertebrae at the level of the C6 and all the way from the C6 to C1. C6 to C1. It travels all the way from this C6 to C1 level, crosses the atlas, travels across the C1 and forms the triangular region, which is known as the suboccipital triangle. Over here we can see the subclavian artery on the other side giving off the vertebral arteries, which are traveling along in the transverse processes of the cervical vertebra around the level of the C7 or C6 to C1, cross the atlas, and they even cross and enter the foramen magnum. But in this region, they create a triangular region which is known as the suboccipital triangle. And they reach the foramen magnum, pass through the foramen magnum, and then fuse to form the basilar artery, which plays a major role in the cerebral circulation. So the blood supply of the spinal cord comes from anterior spinal arteries and the posterior spinal arteries. So these vertebral arteries give off the anterior spinal artery, which runs along the anterior median fissure of the spinal cord, and they also give the posterior spinal artery, which are 2 in number on the posterior aspect. So anterior spinal artery is formed by the paired branches of the vertebral arteries at the level of the medulla and runs in the anterior median fissure of the spinal cord. This is important to remember. And it continues as a slender twig on the filum terminale. So at the ending, when we see the ending of the anterior spinal artery, it ends and it has a twig-like structure at the filum terminale. And it supplies the portion of the spinal, two-third portion of the spinal cord. And its capacity is largest in the lumbosacral region and smallest in the thoracic region. So in the thoracic region, it probably requires the feeders or the reinforcers. So there are some arteries which reinforce the blood in these spinal arteries so that the blood flow is kept continuous and all along the spinal cord. Now talking about, so in this picture, when we see the anterior spinal artery running along the anterior median fissure of the spinal cord, it supplies the anterior two-third portion of the spinal cord. Up till here is the supply of the anterior spinal artery. The posterior spinal arteries, they are present in the sulcus on the posterior side, which is known as the posterior lateral sulcus. These are the posterior spinal arteries which supply the posterior one-third of the spinal cord. Posterior one-third of the spinal cord. These posterior spinal arteries arise from the vertebral artery in most of the people, but in 25% of the population, they could arise from the posterior inferior cerebellar artery. So they descend on the posterior surface of the spinal cord and run along the posterior lateral sulcus. The anterior spinal artery runs along the anterior median fissure, whereas the posterior spinal artery runs along the posterolateral sulcus. And these form anastomosing channels in the pia mater of the spinal cord. And the spinal artery supplies the gray matter, white matter in the posterior region. And on the either side, they bifurcate into anterior and posterior collateral branches. So as I said earlier, that the blood received, even in this picture we can see the subclavian artery giving off the vertebral artery which travels all the way along the transverse foramina present in the transverse process of the cervical vertebrae and forms a suboccipital triangle, reaches and forms the basilar artery. So as I was saying earlier, that the blood received from the vertebral artery and which runs in the anterior and posterior spinal arteries is sufficient only up to the cervical region of the spinal cord. So if this blood which runs in the spinal arteries is sufficient up till the cervical region of the spinal cord, then what about the remaining regions of the lumbosacral region? So if we think that this is the spinal cord, and the blood from the anterior spinal artery and the posterior spinal arteries all the way. Let's think that this is the cervical region. There is also the thoracic region, lumbosacral region. So if this blood in the spinal arteries is sufficient, of course, the picture is, I just drew an imaginary picture. Of course, when we see a detailed picture over here, then we'll understand more better. So if the blood is sufficient only up in the cervical region, then how about the other regions? How about the blood in the other regions? So it's important to ensure the normal circulation in the spinal cord. So there are other arteries which are known as feeder arteries or reinforcers. So their job is so the job of these feeder arteries or reinforcer arteries is to reinforce the blood so that the blood reaches all these regions. So they're ramified and receive blood from the branches of the segmental arteries, which help in reinforcing the blood to all these regions. So in this picture, we can see the anterior spinal artery, posterior spinal arteries on the posterior side, posterior spinal arteries on the posterior side. So this is the cervical region. So from thoracic region, if the blood should be sufficient all along the spinal cord, there must be reinforcing arteries, which we will talk about, which are known as the segmental arteries. So the segmental arteries are the feeder arteries because they reinforce the blood. They enter the intervertebral foramina. In the neck, they arise from the vertebral and deep cervical arteries. In thorax, from the posterior intercostal. In abdomen, the lumbar arteries. And in pelvis, the lateral sacral arteries. So the anterior and posterior segmental arteries are derived generally from the four regions. These are the regions which give off the feeder arteries: anterior ascending cervical, deep cervical, posterior intercostals, and lumbar. So in this picture we can see anterior spinal artery giving off the segmental medullary artery, the segmental spinal artery, which further gives the anterior and posterior radicular artery on either side. So the segmental artery, segmental spinal artery, and there is the segmental medullary artery which directly goes to the reinforce the blood in the anterior spinal artery. Also the segmental medullary artery bifurcates and gives rise to two other branches, which are the anterior and the posterior radicular artery, which is the anterior radicular artery reinforces the blood in the anterior part of the spinal cord. Posterior spinal artery reinforces the blood in the posterior spinal arteries. So these segmental arteries give rise to anterior and posterior radicular arteries. They join anterior and posterior spinal arteries. These radicular arteries are also known as the small feeder vessels or also known as the segmental medullary arteries. So there are the segmental arteries or the segmental medullary arteries which directly reinforce blood into the anterior spinal arteries, or they also give rise to the anterior and posterior radicular arteries which reinforce blood in the anterior spinal artery, and the posterior radicular artery reinforces blood in the posterior spinal arteries. So these radicular arteries penetrate the vertebral bone via the intervertebral foramina, and each radicular artery has an anterior and posterior branch which runs along the dorsal and the ventral nerve roots. So on the either side there is an anterior and posterior radicular artery coming from the segmental artery. So the anterior radicular artery reinforces the blood in the anterior spinal cord. Posterior radicular artery reinforces the blood in the posterior part of the posterior spinal arteries on the other side. So they supply the thoracic, lumbar, sacral and coccygeal segments of the spinal cord. So there's an important point to remember when we are talking about the feeder vessels. So there's the largest feeder among all of these. So there's the largest blood vessel that reinforces the blood in the spinal arteries, which is known as artery of Adam-Kivitz or the great ventral radicular artery. So generally Adam-Kivitz artery, it's the largest segmental medullary artery, and in most of the people it arises from the left or the right spinal artery, and in 30% of the population it could arise from the posterior intercostal or the lumbar arteries from the aorta, and it enters the vertebral canal through the intervertebral foramina from the lower thoracic or the upper lumbar lever, which is generally T9 to T12 in most of the cases, and in some population it could be thoracic 8 to lumbar 1. So this supplies the posterior 2/3 of the spinal cord via the anterior spinal artery. So let's see the location of the Adam-Kivitz artery. So it's over here. It could be from T9 to L2, T9 to T12, or from T8 to L2. So this artery is the main feeder which reinforces the blood in the posterior 2/3 of the spinal cord. So it could arise from the intercostal level, or it could come from the left or the right branches of the spinal artery. So in this picture as well we can see the vertebral artery which gives the anterior spinal artery which runs along the anterior median fissure, and also gives and in some people the posterior spinal arteries comes from the posterior inferior cerebellar artery, or it also comes from the vertebral artery as well. So these posterior spinal arteries run along the sulcus present in the posterior lateral region, which is the posterior lateral sulcus of the spinal cord, and there are segmental arteries which are known to reinforce the blood in the anterior spinal artery and the posterior spinal artery. These segmental arteries also give off the radicular arteries, anterior and posterior radicular arteries. The anterior radicular artery reinforces the blood in the anterior spinal artery, and the posterior radicular artery is responsible for reinforcing blood in the posterior spinal artery on the other side. And the largest reinforcer is the great ventral radicular artery. So talking about arterial vasocorona, this is a ring-like structure or the crown, we say the circle of the crown, which encircles the spinal cord completely and is mainly responsible for the supply of the lateral sides or the peripheral aspect of the spinal cord, and also forms anastomosis between the anterior and the posterior spinal arteries, and hence keeping all of them connected, anterior and the posterior spinal arteries. This is the vasocorona which supplies the lateral parts. So in this picture we can see anterior spinal artery runs along the anterior median fissure, the posterior spinal arteries in the posterior lateral sulcus. This is the radicular artery which is reinforcing the blood, and this is another radicular artery. This could be the posterior and this could be the anterior radicular artery coming from the segmental artery. And this is the arterial vasocorona which forms the anastomosis between the anterior spinal and the posterior spinal artery and supplies the lateral parts and forms a ring-like structure over here. This is the crown or the ring-like structure, and also supplies the peripheral region. So now anterior sulcal or the subsulcocommissural arteries, these arise from the anterior spinal artery and they enter the spinal cord posteriorly via the anterior median fissure. So they enter via the anterior median fissure posteriorly and distribute to the left and the right sides of the spinal cord, supply the anterior 2/3 of the each segment of the spinal cord. So here we can see the anterior sulcal artery supplying the anterior 2/3 of the spinal cord, entering via the anterior spinal artery through the anterior median fissure and supplying the 2/3 of the inner parts of the spinal cord. And over here we can revise the anterior spinal artery. We can locate the anterior spinal artery, giving off the blood circulation in the anterior 2/3 of the spinal cord, and these are the lateral spinal artery or the segmental artery, which gives off the radicular artery, posterior and anterior radicular artery, which are mainly reinforcing blood in the anterior and the posterior spinal arteries, and the posterior spinal arteries responsible for the arterial supply in the posterior 1/3 of the spinal cord. This is the anterior 2/3 blood supply, and that is the posterior 2/3. The 2/3, this part is supplied by the anterior spinal artery, whereas this part is supplied by the posterior spinal artery. So this was about the blood supply of the spinal cord. I hope you like this video.